think I went live. If you guys are tuning in to see this live session today, and if you can clearly see and hear what I'm saying, can you please let me know in the comment so that I will start the session very soon. I'll just wait for the comments and people to settle in, and then I will start our today's session. As you can see from the title, our today's session is about how can you find information about your road to UK, about you making your career in the UK, where all the information is there. And basically I'm trying to give you a checklist of things that you need to consider and think about, making how you can go step by step and find information there. I still don't see any comment. If you can hear me, could you please know in the comment, let me know in the comment, and I will start. I don't know how many people are there actually watching it live. Should I start? If the voice is clear and if you can see me clearly, I'll just start the session. Okay. So today I'm going to discuss about navigating your road to UK. I'm Ibrahim. I'm one of the internal medicine trainees working in the NHS since the last 1 year. Today, this year, I'll be starting my second year of internal medicine training. And I came to the UK 2 years ago via taking the PLAB pathway. And during my whole journey, me and Dr. Ibrahim is documented in our website, which is called roadtouk.com. If you haven't heard about it, please go to this address bar and search for roadtouk.com and read our website. Basically, today's session, the entire session, I will navigate you through our website and give you a step-by-step information how you can find different information required to make an informed decision about making your career in the UK. So let's see the topics today that I'm going to talk about. Is mainly this is the framework of information that you need to gather before you can think about making your career in the UK. You need to first think about whether your medical qualification is valid or not, then the pathway and eligibility to obtain the GMC registration, what the different pathways are there, and what would be appropriate for you, and how you'll be eligible to apply for that. Then if you have to take any exams, how you can prepare and plan for the exams, and then information about if you have to go to the UK for an exam, how you can plan to go to the UK. And this is all about like visa and all the other application. All the information is already there, and I'll just show you where you can find it. GMC registration application, what is the process? What is the step-by-step? What information do I need to provide? What documents I need to gather from different institutions before applying for GMC registration. Applying for jobs in the UK, that's a very big task, and a lot of doctors face difficulty because the whole process may be quite different than what they're used to. And then later on, when you actually start a career in the UK, deciding on a specialty, which specialty do you want to do, how do you find information about a specialty training, and how do you prepare for a training application, and life in the UK outside of work is also very important. So let's just jump in our today's session. I will start with the first topic, like how to find whether your medical qualification is accepted or not, whether your institution that awarded the degree, your primary medical qualification, which in many countries is called MBBS, is accepted by the GMC or not. So most of our viewers obviously use our website from phone. So I'm kind of simulating a phone right here, as you can see. So which article do you have to read to find the information? As you can go down and you see getting ready for GMC registration, how to get medical qualification recognized by GMC. If you read this article thoroughly, you will find out exactly what steps you have to take to find out whether your medical college is accepted or not. As you can see, the first thing is finding your medical college, whether it's on the World Directory of Medical Schools or not. If you just search and see an entry like that, that means it is accepted. Your medical college is accepted by GMC. But you can face other problem, like when you go and open a GMC online account, there is also a list appears where you have to select from the list. GMC online account is required to make for everybody who wants to apply for GMC registration. You have to book your PLAB exams through that. You have to make your online application through that. So we have another article which will guide you making a GMC online account as well. But as you can see, first step is to search your medical college in World Directory of Medical School, and then you, if you find it there, it's accepted by GMC. If you can't, then you have to email WDOMS. They have an email on their website, and find out how you can get your medical college approved. In most of the cases, you'll have to get an approval letter from your medical council of your country. Like for Bangladesh, it is Bangladesh Medical and Dental Council. If your medical college is approved by Bangladesh Medical and Dental Council, then you can apply to WDOMS for getting it listed, and thus GMC will get it listed too. So there are some other papers you may have to submit if it's already not in the GMC list. And I also, in this article, you can download this form that you have to fill up and get it signed by the principal of your college. And sometimes you have to make a record of your clinical rotations and also course length. So all these templates are already there. You can just click on it and find out what information you should put in there and make your own letter if your medical college's authority doesn't know what GMC want. So you can make a letter like that, get it signed by the principal and apply, and thus your medical qualification can get verified if it is from an approved institution from your local medical council. So let's go back to next step, which would be how to find information about what are the different ways you can get GMC registration. So different ways of GMC registration is, I think in this article, is how to get registered with GMC. So if you read this article thoroughly, then you will find that there are mainly three ways you can apply for GMC registration. If you are a medical student or an intern, I think PLAB would be the easiest way to and the quickest way to get GMC registration. PLAB will be valid till 2024, till of today. GMC will start UKMLA. UKMLA stands for United Kingdom Medical Licensing Assessment in 2024, which will actually be like PLAB, but it will be more standardized, and UK graduates will have to take it as well. When I say it will be actually be like PLAB, because it will have two parts. One will be MCQ, which will be computer-based, and another will be like PLAB 2 OSCE based exam. So there is no structurally difference of the exam, but I think it will be just more standardized, and as UK graduates will take it as well, so it will be an universal exam for everybody to take. So let's go back to how to find information about different ways of getting GMC registration. As you can see, there are three ways you can get GMC registration. Oh, let me just explain what are the types of registration you get. You get provisional, which is not the case if you have already done an acceptable pattern of internship. This question I will also answer in a few minutes. What is an acceptable pattern of internship? Then you get full registration if you already have done an acceptable pattern of internship and passed PLAB exams. And when you actually complete the entire training or residency in the UK, then you can apply for a specialist registration. Or if you complete GP training for 3 years in the UK, then you can apply for a GP registration. So GMC offers these 4 types of registration. But I think the next step would be to find out what are the ways you can get GMC registration. So first is passing the PLAB test. And the second is, as you can see, this PLAB pathway. Second is having an acceptable postgraduate qualification. So GMC has a list of acceptable postgraduate qualification, if you go to this link, you'll find out the different Royal College membership exams like MRCP, MRCS, MRCOG, Pediatrics, MRCPCH, and some other foreign exams like from Bangladesh is FCPS anesthesia if obtained after 1999, only FCPS anesthesia. Then if you go to European country, EDIC for anesthesia is also accepted for GMC registration. So I would always advise, go to this link and find out what are the acceptable degrees, because sometimes it changes as well. Sometimes GMC stop recognizing some degree. So if you're that, I'll pursue that degree, but when you find out you complete the degree, that degree is not recognized anymore. So make sure that you always check the GMC's link, which can be found in this link. And the last pathway is the sponsorship route, which is applicable for who are already established doctors in the UK, already established doctors outside the UK, and obtain some 3 to 5 years of clinical experience and have some postgraduate degree, like they completed some MD or MRCP Part 1, Part 2, and they want to go to the UK for a short term and get a registration via that pathway, as well as some diploma and complete the rest of their membership exam. So this is not for the new graduates or even the intern doctor. It is for some experienced doctors. If you have completed FCPS, say in medicine in your country, and now you want to go to an MTI post, you can actually try and apply for that. It's a very lengthy process because there is no exam in this pathway. So it takes a lot of time, and there's a lot of selection process goes on, and not always guaranteed that you will get registration in this pathway. But you can try if you want to, and details of this pathway is written on this article, which is called Medical Training Initiative in the UK. As you can see, much detail here. We will not go into that detail. We will move on to our next topic about how to find the different methods of planning. Like, say you've decided now, my medical qualification is approved by GMC. I will take PLAB exams, but when? How do I apply for it? What are the criteria and everything? Everything is answered in our blog. As you can see, how to plan for Ielts and Oit. If you can go into English language proficiency, you can see there is an article about Ielts, Oit for PLAB, GMC, and Tier 2 visa. In this article, we've extensively discussed about what will be the Ielts requirement or OET requirement. If you give a read through, then you will actually see what are the requirements. But I can just shortly briefly tell you that for Ielts, the requirement is 7.5 overall with a minimum of 7 in each. So if you get minimum 7 in all, this is not meeting the requirement, then you will get an average of 7. So you'll have to score 8 in 2 at least, or 9 in 1 and 8 some others, make it an average of 7.5. So if you get in some point, sorry for that. So if you get in some point that in writing you get 6.5 in Ielts, then that Ielts will not be accepted by GMC. So this all is explained in this article about whole thing. Previously there was a thing called Ielts for EQVI, but it's not needed anymore, because for job application you don't need Ielts anymore. If you have GMC registration, which you will have by the time you apply for job, you can use that as your English language proficiency, and you don't have to think about Ielts for EQVI. So basically, you can take Ielts academic version or OET medicine version, and what are the requirements, all are explained in this article. So there goes the first thinking about what Ielts and OET. Now, if you want to know how to prepare for it, we have article for that as well. As you can see, it's how to prepare for Ielts and occupational English test. I'm not going to click this detail. If you are interested, we have linked a lot of easy to find materials uploaded in different drives. You can download it from there. We always update these articles whenever we find something new, and upload it on the drive and give it in the link. So if you click those links, you can find information about how to prepare for Ielts, or how did we prepare for Ielts, and how to prepare for OET as well. Now you have passed Ielts or OET. Now we're going to think about PLAB 1, or you can actually think about PLAB 1 before taking Ielts and OET, just to understand when to time everything. So this is quite important because PLAB 1 happens like 4 times in the world. So sometimes there is a slot for June and September in Bangladesh or some other countries, but sometimes there isn't. But always there is a slot for March and November. So timing is quite crucial. That if you take, say, September exam will not happen in Bangladesh, just for example, say, and you have taken IELTS, so you'll just sit there until November exam comes. So this is quite crucial when you take your IELTS or OET exam and when the results will be out, and then you can actually look for PLAB 1. So having the time frame in mind is quite important if you make that plan, and that is why we've written this article where actually we have discussed about planning on the dates. As you can see, this is all descriptive discussion about how to plan for booking IELTS and OET and how to think that when the time will come and when I can actually get the results and everything. As you can see, give me a timeline as well. It's like if you plan to do this that way, and how will we prepare and which PLAB 1 you will target. Okay. So this is preparing for PLAB 1 and IELTS and OET. So you have passed PLAB 1. I think the next big thing is to go to the UK for PLAB 2. And I'm sure, I mean, it was for me at least that visa application was an enormous task to go through. And wherever I turned, everybody said that you have to go to a visa, people who guides. And actually, when I actually went to them, not basically, I actually searched for them and everything. They're mainly focused on sending students, not that well versed with visitor visa, or they haven't even heard about PLAB exams. So it was quite difficult for me to gather all the information and everything, but I did, and all the information is actually right here. If you read this first 3 articles, and I'd say first 4 articles, UK Visa for PLAB, online visa application, it just talked about how the visa application, what information you need to put online, then supporting documents, what are the documents you have to put together, and what are the final preparation and financial sponsorship documents. I really emphasize to give this article at least a read and find out about. Many people ask about how much money should I show for my PLAB 2 visa. So the answer to this question is already in this article. As you can see, we have written this in detail. We have given some template about how to show bank statement, solvency certificate, affidavit, all these common errors and everything. And this is just a very, I myself has updated this article many times after hearing questions from all the people, like what are the information that you need. So instead of asking us questions, you can actually give this a read and all the information is already there. So there we go. You have very good collection of information about applying for visa. Okay. Seems like it's playing up a bit. All right. So I'm kind of going a bit fast. If you can tell me if you are following me properly or not, because I feel like that I'm going really fast. Okay. Let's go back to our phone here. So now I am going to talk about, you have got the visa, but before even I think getting the visa, there is another step I missed, is actually planning for PLAB 2. So where are the information for planning for PLAB 2? How to plan for course academy and PLAB 2, this article. And I think before even all of it, if you have a question, how much money I will need to take this entire PLAB journey, we have an extensive article here which is called How to Plan Expenses for PLAB Journey, where we discussed at length, starting from your passport even, because when I thought about going abroad and taking this exam, I didn't have a passport, so I even included that cost into the whole cost thing. And here you can see we first talk about what are the steps, and then every breakdown of cost. Recently, there has been an update about the Tier 2 visa. It has been reduced. So to reflect that, we have actually updated our article. So you'll see, whenever anything changes, our article always gets updated. Like there is no international health starter anymore. That was £400. That's gone. So I deducted it from the whole cost list. So the whole cost can be divided into 3 steps. A lot of people think like I will need like 10 lakhs of taka at once. No, it doesn't you don't need it at once. So you can actually stagger the whole cost in 3 steps basically, and there is validity for that as well. For Ielts, there is a validity for 2 years. For PLAB 1, there is a validity of 2 years. After PLAB 2 passing, there is a validity of 2 years before you can apply for GMC registration. And once you get GMC registration, it stays with you forever as long as you pay the yearly money. But that's the thing. It's just you have to understand the timeline, and that is why we have written all these articles. All right. So this is the cost, and we will go back to how to plan for PLAB 2 courses and academy. There are many academies in the UK which helps you prepare for PLAB 2. You can take one of them mainly for finding other fellow colleagues who are preparing for PLAB 2 and having a partner to practice the different kinds of scenarios that can come according to the GMC's blueprint. So just because it's different, because you probably haven't seen any patient in English, like, speaking in English. So it kind of needs a bit of practice. But I think the bottom line of medicine is the same. Like, you have to be empathic, you have to be listening to the patient, and you have to use your clinical judgment of making decision. So that actually remains the same, whichever country you go, whichever language you speak. So that is the next bit about going to the UK and taking the PLAB 2 exam. So you take a PLAB 2 exam, and there is no need for you to stay in the UK afterwards, because the whole process of GMC registration application, applying for jobs and everything can be done via online. Even the job interviews can be done via Skype. So there is no reason for you to stay in the UK after just taking PLAB 2. I would probably wait until the results are out, because God forbid if you fail, then probably you can book again and take the exam again if you have the opportunity. But if you pass the exam, there is no reason for you to stay in the UK. You can just come back and apply for GMC registration. So GMC registration, I think it's better to think about this when you are actually all the documents and everything. So it's an article about documents needed for GMC registration application, where you can actually find what documents is actually needed. A lot of people ask, I worked in this hospital, do I need to get a character certificate or employment certificate? No. Actually, if you work medically in any hospital, but you have been registered with a medical regulatory board, like say you are already a full registered doctor under BMDC, and you have worked in say 5, 6, 7 different hospitals already. Now, do I have to go to each and every hospital and get an employment certificate? No. You just need to get certificate of good standing from BMDC, and that is it. You don't need to go to all the other hospitals, because if you are registered to do medical work by your local medical council, and if they don't have any problem with your clinical work that you're doing in that country, GMC will not have any problem. So it's very important to give a read through this article as well. Documents required needed for GMC registration application, and EPIC verification for GMC registration. That is also another thing that you have to do before you can proceed to submit the application. So even if you passed PLAB 2, before you can submit, you have to complete the EPIC verification. So I would suggest, if you're taking this route, do the EPIC verification after you passed PLAB 1, or even you can do it before PLAB 1, because EPIC verification does not expire. So it will be, once it's done, if it's sent to GNC, it will be staying there forever. So if you want to know detail about how to verify your primary medical qualification via EPIC, and how to open an account, what to do, and what the troubleshoots and everything is written in this article already. I would also suggest, our blog posts are there for a long while. As you can see, it's actually updated last in May 1, 2020, but I'm pretty sure, as you can see, it's had 190 comments. So when you read an article in road2uk.com, also go through the comments, because a lot of people like you who is actually wanting to go to the UK question came up in their mind and they asked us in the blog article, and we answered that. We may or may not have included that answer in the article later on. Sometimes we do if we find that this is an integral part and somebody pointed it out and asked the questions. But sometimes the question may arise in your mind that is already someone asked and we have already answered. As you can see, after this whole thing, if you go down and we have all of these questions, if you just filter from the newest one, as you can see, everybody has a question and there is an answer to each and every question, because I think the best way to get an answer from us is to post a question in an article. We always be on top of these questions because this actually enriches the whole content. So if you have any questions regarding anything after today's session, please read the relevant article in our website and put a comment there. It's really easy to put a comment. I think you just have to put your name and email ID. You don't have to open any account or anything. And then you can just put your comment below. And when we reply to that comment, you'll automatically get notified in your email that there was a reply. So this is one thing, very important, because some of our articles have like hundreds and hundreds of comments where people all over the world had questions in their mind and we have answered, and probably your question will be answered there as well. So Gmc registration application will come after you have completed all these steps. So your PLAB 2 is done, your EPIC verification is done, and then you will apply for Gmc registration. I told you earlier, to book PLAB 1 and PLAB 2, you'll have to open a Gmc online account. All the steps of opening a Gmc online account is already in this article, how to book PLAB 1 and open a Gmc online account. A lot of people ask questions, oh, I'm opening this, what will be the answer? I don't know, they ask in Facebook, they send us message, they send us everywhere, but they fail to read this article, because all the question you can ask about what to put in this, in the address, there's ask for organization, what should I put in there, what address should I put, what title should I put? All these questions are already answered in this article. If you just go and have a read, you can actually have the clear-cut walkthrough of how to open a Gmc online account. This online account will actually help you to book PLAB 1 after you have completed Ielts and Oit, and book PLAB 2 and apply for Gmc registration, making a Gmc registration application after you book PLAB 1 as well. So if you're applying through the MRCP or MRCS route, you also have to open a Gmc online account, and there is an option when you apply for My Application, you can apply via postgraduate qualification pathway. But before going that, make sure that you have done your EPIC verification of your postgraduate qualification as well as your primary medical qualification, and also you have an acceptable score in Ielts or OET. So as you can see, this article actually entails about how to open a Gmc online account. The requirements to book PLAB 1, then what are the steps, and as you can see, how you can actually find out your route and ultimately go to a page where you can set up the Gmc online account. As you can see, all the information you can see. One of our follower of our blog actually find out how, if you don't have a surname, you can put a dot or dash in the box. I have seen hundreds of questions floating around in social media. What to do? I don't have any. My passport only has first name, don't have any surname. The answer is already there in our blog. So if you follow it, it will be really easy for you. If you just open this article in one tab and open Gmc Registration Application in another tab, you can just follow along and make your application really easily. So you have applied for Gmc registration and you've gotten the Gmc registration, because you will get an email. They will probably ask you for some documents to send. You already know what documents to gather. And after the documents being sent, GMC will send you an email. Congratulations, you are on the GMC registrar. Then basically you are qualified to work as a doctor in the UK right then and there. So the next steps will be finding a job. So this is quite one of the big tasks. A lot of people fail to understand the process and the different detail of the whole process. So NHS Jobs is a website which is actually the prime website for jobs in NHS England. So there is also a branch of NHS England and Wales. So there is also a branch of NHS Scotland and Northern Ireland. They have separate websites. where you can actually look for jobs and apply there as well. So everything is online. The application wise, you have to make an online application, you have to put your information there, and after seeing your application, the recruiter, the employer of the hospital, actually shortlist you, and after shortlisting, they call for an interview, and after the interview, they will give you a job. And when they give you a job, they will give you a sponsorship certificate, which is called COS, actually, but Certificate of Sponsorship. With that certificate of sponsorship, you can apply for a job visa, which is Tier 2 visa. Recently, it's been transformed into Health and Care visa, which is less costlier than the previous one. So I think it's the high time if you want to move to the UK. Everything is actually being level and easier for doctors around the world to come to work as an UK. So there are other detailed articles actually I have skipped, but I'm actually going through the important ones that you must read to gather the information, the basic information that you need. Obviously, if you go to our blog roll, there are like hundreds of articles and you can get lost. So that's why this whole session I'm arranging, so that you can go step by step and read the relevant articles and have an understanding about the whole process, and then make a decision how to go forward. Okay. So getting an NHS job, we have written an article there, how to put the CV, what component you have to have in your CV, how to apply for jobs, how to find a job. And these are the written articles, descriptive. But apart from all of that, we have Road to UK Academy, where we have actually video course, where I'm actually making a job application, looking for jobs, explaining how the website works, how you have to filter, how you have to find, what you have to search. Everything is already there in video lecture series, which is in Road to UK Academy. So I'll just briefly show you how the Academy looks like and how you can access. This is the Road to UK Academy. This postgraduate training pathway, we're still in the process of finalizing the lessons, but these two courses are already done. As you can see, this is for free. Applying for jobs in the NHS, a step-by-step guide for IMGs. We have like probably 10 or 12 lessons where I've actually gone from each step by step. You just have to log in, make a small account with one click, and actually you can go and take this course. So the content of the lessons are what is a difference between different jobs, what are the levels of doctors' jobs, how to make an NHS jobs profile, how to find the right job advertisement from the entire website, because NHS jobs website is not only for doctors, they also advertise nurses, receptionists, physiotherapists. I mean, all the jobs in the NHS are advertised there. So it's really, you have to know how to filter and find those jobs from this entire website, and what things to look for in a job advert. So this course is, I think, I would say, is imperative for you to go through if you're applying for jobs in the NHS right now. If you have already done, I would also suggest to go through the articles as well, how to apply for jobs, how to find a job in the NHS, where we have actually discussed earlier about different ways you can do. You can find that here, getting an NHS job in this tab. Creating a perfect CV, how to apply for jobs, and this article are quite detailed as well. Now you have landed an interview. How to prepare for an interview? I've never taken an NHS job interview. I don't know what question they will ask. I don't know how will I answer those questions. We have answer to that. If you read this article, NHS interview question and answer, it actually, we have molded these articles a lot of times, because as you can see, obviously it's not written on March 17, it's actually updated last on March 17, and we have discussed about how to answer those questions, the very commonly asked questions. I have recently heard from one of my senior college brother who actually got a job in the UK. He soon will be coming to the UK, and he said that he felt like the interviewer has actually read our article, because exactly the same questions, because it's the rubric of asking questions, because NHS follows a structure. They have to tick box that this doctor knows about this, and they answer this question, and this is the answer. Actually, if you go through this article, I'm sure your job interview would be like a walk in the park. All the thing you need to prepare is the clinical scenarios. It will be based on what specialty you work in. Like obviously, if you interview for an acute medicine job, the clinical scenarios will be different from a pediatric job interview. So clinical scenarios you have to read from your Oxford Handbook, or I would say the normal, the clinical scenarios that are very acute in nature and for your level to understand. Just read those nice guidelines or some information related to that, and then you can actually find the answer to that. But other questions like take me through your CV, what is a camp structure? This is a structure that is developed by, I don't know who, but developed by someone, which gives you an idea about how to answer these questions. So I know this might look a bit far-fetched for you if you're just a medical student right now. All this conversation might be like, nothing gained. But I'm telling you all this so that when you take these steps and go at that level, you'd be surprised how quickly time passed by. I just started internal medicine training a year ago, but it seems like yesterday the year just passed. So once you actually take these steps, you'll see that the time is passing really quickly, and you might feel confused about a thing or two. To guard that confusion, I'm showing you right now where to go and find the information. So this is the interview, and everything is already here. And after the interview, I think another thing I would like to say about finding out different specialties. So I think this is also a very important thing. You can actually look at this right now if you're still a medical student, that how an emergency medicine training happens in the NHS. Or basically, I would say understanding the training and residency pathway in the UK, which is very, very different from, I'd say, Bangladesh, obviously, and many other countries. I think the most confusing part, I think we say it almost in every video. We have videos in YouTube talking about post-graduation in the UK. We have written articles about master's degree and diploma, but still people are confused. And I want to say that again, I don't know how many people are watching this. MD, MSc, and MS, these kind of degrees are run by universities in the UK. So there is a university, say University of Leeds or University Imperial College of London, or whichever university is there in UK. There are many universities. So these kind of degrees, MD, MSc, MS, or MPH, these kind of degrees are done by the universities. So you go there as a student, you pay the university to teach you about those things and give you a degree. Like you obtained MBBS. You went to a college, medical college. You obviously have to pay them something. Like if it's a government, probably nothing. But not nothing. Obviously, you have some fee there. But you go to the institution, you were a student there, and you learn something, and you get a degree after you pass the exams. Same thing happens when you go to take an MSc degree in the UK. I'll just open this article, I think, and then we will go into detail. It will be post-graduation in the UK, where this is master degree and postgraduate diploma. So yeah, let's get back to this MD discussion. So the universities are not providing you with professional training in the UK. Professional training as a doctor to be a specialist are provided by the Royal Colleges. We obviously heard of Royal Colleges of Surgeons in like Edinburgh, Glasgow, then Royal College of Physicians in London. So they're Royal Colleges of everything. These are faculties which, people have gotten together and made a curriculum to train different doctors according to their standard. They made a standard and they said that, okay, if you want to be a cardiologist, what things you need to know. So they made a curriculum. If you want to be a nephrologist, what things you need to know. They made a curriculum for that. So all these curriculums are made by the Royal Colleges. And you become a trainee under the Royal College. So Royal Colleges are a body, but the implementation of having a job and everything is done by the deaneries, which are called, the whole entire UK is divided into many deaneries. I think England has 13 deaneries. England's main organization is called Health Education of England. It also, takes care of the education of nurses as well. So they basically monitor the employment of the doctors who are trainees under the Royal Colleges. So I'm actually getting money from Health Education of England, but I'm following a curriculum for the Royal College of Physicians, the joint Royal College Physicians. They all joined together and made a curriculum for internal medicine training. So this training is paid because I am actually working under an NHS hospital where my deanery has appointed me. So my hospital is not actually paying me anything. My deanery is paying me money. So if you're a trainee, you're getting paid by the deanery because they are filling the gaps in the hospital with the trainees. But if you're working for a hospital, that means you are in a non-training post where you're getting paid by the hospital. So this information is quite vital about planning your career. A lot of people think, okay, so if I go to the training pathway, what will happen? I will have to complete MRCP. I'll have to complete, like for medicine, I'll have to complete some SCE exam of the specialty that I want to specialize. Like say, after internal medicine, if I want to do cardiology, then I have to pass the SCE exam in cardiology. And I will be, after successfully complete my training, every year there is a check about what am I doing, is my progression is going well or not, and then they will be able to proceed towards getting a specialist registration. So after I become a cardiologist, then I can apply for consultant job in the UK, or if I want to go anywhere, I can go anywhere. But if you want to take a surgical pathway, so you get MRCS and then you get FRCS of your surgical choice of specialty in general. So that's the degrees, or I'd say post-nominals you get after you get this training pathway. Now, if in this training pathway I decide, no, I would also want to do a master's degree somewhere. Yes, I can do that. I have my money. I will go to a university and tell them I'm to do a part-time master degree, and I'll have to talk to my deanery as well that I want to take this degree. I will go out of training for 2 years and then come back again. Can I do that? If they approve, then you go out of training. That's the whole process. That means a lot of doctors also do MD degrees while they're in training or the later part of the training. But I think most of the doctors do MDs and further academic degrees after they become a consultant and completed all their training, and then they pursue further. Maybe they do research if they're research oriented and go on and go forth. So understanding this is quite important. This is a very common question asked by how can I do an MD? So if you do an MD, it doesn't give you GMC registration at all. So there you go. You cannot work in the UK as a doctor through this process. You can get a degree but cannot work in the UK. So this is about the whole training pathway. We also have articles related to separate specialties. Like if you want to understand how to become a medicine specialist, then you have to read this internal medicine training pathway or medicine training for UK. I think we have a separate post here. As you can see, there's an overview of specialty training where actually it is discussed what I just said. If you can read through about medical training in the UK, this is an article. Basically, medical training in the UK is all streamlined. Like, if you are a cardiologist or nephrologist or respiratory medicine, all is going through internal medicine training. So everything can be discussed under one article. So it's already there. If you want to know about, oh no, I want to be a surgeon in the UK, what do I have to do? All is discussed in this article, surgical training in the UK. Surgery also, apart from neurosurgery and cardiothoracic surgery, and I think surgical ophthalmology, all of them are going through a core level training, which is core surgical training, and then you become a neurologist, then you become a general surgeon. After general surgery, you become a colorectal surgeon, then you become a vascular surgeon or ENT, that branch from core surgical training. So understanding the training pathway, if you want to know, this is the article that you have to read. And also we have discussed about training in various specialties, like if you want to be a GP, what is the GP training like? You just can't come and become a GP. You have to go through a GP training, which is 3 years, and then you can apply for a GP registration and become a GP. And then pediatrics, what's the pathway? Gynae, what's the pathway? Radiology, what's the pathway? And a lot of people, I think we updated this pathology. This includes microbiology, virology, hematology, and all that related to lab is all in that article, careers in pathology. And a lot of people ask about this as well, like, how to become a medical microbiologist in the UK. So everything is already there in the article. If you just give a read and you'll understand. So yeah, there you go. We talk about microbiology and virology here. what is the pathway to become a microbiologist in the UK. There's a core level training, and there's a combined infection training, then there's a higher specialty training. So it's all there in the articles. You just have to read. And if you read something in the article and you're not understanding, comment there. We're always there to answer to your comments. There is no problem in not knowing or not understanding what we have written or what anybody has told you. But if you don't ask, you'll never know. So this is the place to ask. So I think we've covered kind of all of the topics that and how to actually prepare for your training application and everything. We are in the process of covering all the different specialties, but we've already described in details about internal medicine training, how to prepare your portfolio, and how to prepare for the interview, and how all the things come. I think prepare for your portfolio will actually resonate to all the other specialties as well, because there is some, as I said, like NHS job interview, all of the training application kind of has a similar tick box saying like, do you have an audit done? Do you have teachings done? Do you have presentations? Do you have poster publications? And all the other things. So when you're starting in the NHS as a doctor and you say, I want to become a general surgeon, so set your mind towards that and find out what things you need to do. A lot of doctors might need to have a crest form signed, and we have a detailed course on that. I'll just not go there right now. Time is running. So yeah, so this is how you can find information in our website about different training pathway and how to get prepared for the training application. So apart from all of this, this whole description about work, training, a job, and all the other things, you also live in the UK. You'll have to live in the UK with your spouse and children and family. So we also cover that part as well. So as you can see, I think years ago, living in the UK, how to open a UK bank account. So you'd be surprised how many people find it difficult because they don't know what paperwork they have to submit, what paperwork they have to get. All is there. Then winter in the UK, it's very cold for me, but now I'm in southwest in Plymouth, which is kind of one of the warmest in the entire UK, so it's quite pleasant. It's really sunny outside today. But how to be if you're in the Scotland or in the north portion of the UK, how actually you can tackle everything is there, because we were in Yorkshire for 1 year, which was really cold, and snow is not that lovely as it looks on the TV. And we also how to rent property in the UK, how to apply for driver's license. So all this article and step-by-step guide on buying a house. So I know that if you are just a medical student, all that I have discussed or all that I have shown here right now might feel like overwhelming. But I just want to say that information is there. Everything that you can think of from your stage to come to where I am right now, I have documented everything. So you just have to read, and you just have to understand the information that is already there. That is the whole purpose, and that is how you navigate your road to UK. I hope that after actually watching this entire video, you'll be able to go to our website. Or I think I will show another neat trick in our website, is that it's a quite intelligent search option as well. Like, if you think about what do I have to do? If you just type on Ielts, it automatically searches and gives you the option which article you need to read. Another thing I think I missed completely is, I'll just show you quickly, articles for you. So if you feel that, oh my God, it's so many articles, I can't just start reading for here. If I start reading, if I go to this third one, I'll forget the first one, and that will happen. So if you click get started, as you can see, we have 3 ways you can access or get the information together. The first will be articles for you. We'll go there, and the courses and the blog roll. So everything is for free, obviously. So articles for you, how does it work? So if you go to learn more, and the articles for you page loads, and as you can see, are you registered with GMC? Obviously, say you're not registered with GMC, then it takes you to another questionnaire session, where primary medical qualification. Have you completed primary medical qualification? So if you haven't, let's say you're an intern and looking to take Club 1 and you haven't passed IELTS yet, if that's your situation. So yes, I have completed my primary medical qualification. And have you completed GMC Approved Internship? We have an article on that internship. How is that? If you are from Bangladesh, your internship is approved because our BMDC actually has a mandated 3 months, 4 months, 4 months, 4 months, and that automatically approves with GMC pattern. You don't have to think about that. But if you're from any other country where you can actually choose your rotations, then I would advise to choose at least a mix of medicine and surgery. In the entire 12 months, you have to have minimum 3 months of medicine and minimum 3 months of surgery. Obviously, Bangladeshi interns do have that. You don't have to think about that. So GMC Approved Internship is yes. Postgraduate qualification, if you have completed MRCPA and everything, so let's say you haven't, and then English language proficiency, or now it's like, I haven't actually, I'm preparing for Ielts or I'm preparing for OET, so you say no and see what happens. So after you answered all these questions, if you just go through it, we have made an intelligent filter options. So this filter option actually will filter all the relevant articles from the hundreds of articles that we have written that you need to read before you do anything else. So you can read this article, then expenses, then what is the IELTS requirements, how to prepare for IELTS, how to prepare for OET, what is the internship requirement, or if you want to join UKFPO, what is UKMLA if you are, say, first or second year and will graduate in 2025 or something. And then how to plan your PLAB journey is a whole summary together. Then 6 reasons why I love working in the NHS. It's just to motivate you, and breaks and gaps in your clinical practice. I mean, obviously, if you're not from Egypt, it will probably not help you. But you know, these are made for international. So yeah, and how to get your medical qualification recognized, and this. So see, these are all the articles that has actually curated from all the articles that you've written. So if you just read these articles right now, you'll basically know what steps to next. So if you have passed IELTS or OET, then you go back to the questionnaire and say I have passed IELTS and OET, and then see the next question and just read through that. So this is where you don't have to read everything in our website in one sitting. You can just filter all the articles this way and actually find out what articles are pertinent to your level. So I'll just go into a bit overboard and try a bit different thing as well. So I think we will go for... So if you have GMC registration, it's also helpful for you, because then we talk about, then it filters through which specialty you want to talk, like what department you are working, and like you want to work, and what would be like to work in that department in the UK. Like we have articles written for like, how is it like working in gynae, how is it like working in acute medicine, how is it like working in stroke. So we have experienced articles. I'm now in cardiology. Obviously, after this cardiology rotation, we will write an article about how is it like working in cardiology in the UK. So by reading that, you can actually get an idea about how things are like. So I think we will just go back to the question answer session right now. And I hope the whole purpose of this session was to give you a very concise idea about where all the information are. Like I always say, a lot of people like sends me messages and everything, and I give them link, I give them this link, and I give them that link. The thing is, you can find this link yourself. Like if, like I don't know how many people are watching, if anything related to UK journey comes to your mind, I hope after today, you just go to Road to UK, find the related article, read the article. If you have any question, they put their comment or like question in the comment section in the article, and we'll just get back to you as soon as possible. All right, so I will go to Facebook and find out if there's any question. I don't see any questions. I don't know whether how many people actually watched it. But if you have any questions regarding anything about like Road to UK or the whole, I'm not sure actually, is it not showing or nobody actually commented there? Firoz Mondal asking Bangladeshe kibhabe. So how can you build your portfolio there? So if you go to our article, Creating a Perfect CV, you will actually see what headings are there. So in that heading, you will find what different things you have to do. If there is a teaching, do a teaching of the medical students or the interns or anything and get feedback signed from them and keep it with you. That's a proof that you have done a teaching. Or if you do a departmental teaching in your department or do a presentation, get a certificate made and say that on this day, this doctor has taught this topic in the presence of this many people, signed by whoever is the senior doctor there. So there you go, you have a feedback. And that's how you gather the teaching experience. In Bangladesh, you can do, I'm pretty sure all the medical students have done some sort of, in their community medicine, there is a project. I had to do one. You can actually show this project as a clinical audit or a research thing if you have done so. So there you go, you have one from your medical school, from your third year or fourth year. Or you can actually do an audit. Is very simple to do if you understand how to structure an audit by reading our article. You can actually say national guideline is this, but we are doing this. How can we improve our process of giving care to the people? So you just have to know different things that is required and translate that to your country's scenario so that you can put it in your portfolio. So we do a lot of things, but we don't have any documentation for that. And if you don't have any documentation, you cannot prove it in your portfolio. So you can just say all day that I have done 300, 400 surgeries, but if none of your senior doctor has signed you off that this doctor has actually done all these surgeries, it's not valid. So if you are an orthopedic surgeon or you're an orthopedic trainee right now, like working in some say in Bangladesh, and now you do operations or procedures every day. If you keep a logbook of that, and at the end, do different kinds of things, and at the end, print it out and put a LOR by your supervising consultant that this doctor has done all of these procedures on this date, and he's really good and his performance is satisfactory, he signed. I'm pretty sure if you go to your professor or your consultant who are you working with closely, they will be able to do that, and you can actually show this in your portfolio that you have done all this thing. But if you don't have any proof, there is no way you can actually show anything, and that is what lacks in our country. We have done so much thing in our internship, but due to lack of proper documentation and proof, we cannot show this when we go abroad. How will I calculate the time between passing OET and booking PLAB 1? So you have to remember when the result is coming out. So IELTS result, I think it takes around 2 weeks, and OET also around the same. So if you take an exam date, when will be the result out? After the result out, how far is the PLAB 1 date? So I would say as everything gets booked really quickly, you have to at least have, after you have the IELTS result or OET result, you at least have to have 3 to 4 months gap to be able to book a PLAB 1. It's my guess, but I think things are more concentrated now. So basically, for PLAB 1, you have to just concentrate on clearing IELTS and OET. And after the day you cleared IELTS or OET, you just go to GMC online account and see what date is available for booking PLAB 1 and book that one. So that is how you have to proceed, because things are getting booked really, really early. So I think you concentrate on passing IELTS or OET first, and the minute you get the results of your OET, go to your GMC online account and book the PLAB 1 date that is available and suitable for you to take. Yeah. All right, so I think it's been almost an hour, and I don't want to prolong the whole thing. And if nobody has any questions, I think I have answered all of that, or you can find your answer in our website. So I would want to end this whole session by saying that don't feel that you cannot do it. Like if you have the will, I mean, there's always a saying, where there is a will, there is a way, and the way is Road to UK. So if you feel that you cannot find anything, that after watching this extensive video you're still not feeling that I can actually find the information, we're always open to, you can contact us through Facebook Messenger, but as I said, the best way you can actually contact us is actually commenting on the blog article. As you can see, it actually collects all the information together for the next person. You are actually helping the next person by asking a question there. So please do that. And I think I just, oh, I see another question. I just answered that. What should I do if my medical college is not listed in the, I already said that. You have to contact World Directorate of Medical School. There is an email in their website. I'm sure it's info@wdms.org, and email them that I am a student of this medical college of this country. It is not listed. What should I do? So they then contact you back with documents and everything that you have to submit. Then you have to go to BMDC. If your medical college is approved, obviously to function in Bangladesh, it has to be approved by BMDC. So if your medical college is approved by BMDC, then you go to BMDC and collect all the documents and sign, and then send it to WDMS, and then it will be approved by WDMS. After getting it done, GMC also might want you to send them the clinical rotations and the proof and everything, which is already there in the article. So if you read that article, how to get your medical qualification recognized in the UK, you will have an idea. Thank you, sir. Thank you for tuning in. So I think it's really lovely. I think that there's not many questions, but if you do have further questions, Road to UK is always open for you. Thank you for watching this video. Have a nice day.